I'm Dr. Manny Pena, and I'm a plastic surgeon in Naples, Florida. I started practice in 1990, and shortly afterwards they introduced Botox for cosmetic reasons. Actually off-label, because they've been using it for quite a few years for children with lazy eyes. And then by accident they found that adults with spasms in the eyelids, they could use them to improve their problem. And by accident again, they saw that the lines around the eyebrow and the eyelids were actually improved. So around 1990-91, we started using it cosmetically. So we learned a lot, and recently there's been other ones introduced, but they're basically the same atom, the same molecules, and they just have different wrappings on them. But they produce the same effect, same length of time. Some act a little shorter, some spread a little bit more, but I'm going to concentrate on Botox because that's what I use pretty much in my office. One of the big misconceptions is, what does Botox do? And it's actually neuromodulator. That means it stops the transmission of the nerve to the muscle, and it weakens the muscle. It can paralyze the muscle. It doesn't fill anything, but by weakening the muscle, the lines that are caused by the facial expressions directly over these muscles are improved, and then they're weakened, and then they eventually go away in most cases. I have a little illustration of the muscles of the upper face, which is where I'm going to concentrate today. And the major misconception is, how do we get the brows to go up, and what happens if we inject Botox into the forehead itself? So I'm going to explain that right now. This is a little diagram of the face, the upper face, and the muscles, and I'm going to go one by one. The most common two areas that are treated are the area around the eyes, which is the crow's feet, and the glabellar area, or the central forehead, which is the, and they represent the crow's feet and the 11s that you're talking about. And the reason that Botox is so frequently used there is because they have very few side effects there. They don't drop anything. They don't cause an abnormal appearance if properly used. So I'm going to go over a little bit about that. Now notice that the muscles are in 90-degree angles to where the lines are. The blue represents the lines, the crow's feet. The blue represents the 11 here. And there's another little muscle at the base of the nose that's called the procerus, and it's responsible for the transverse line in the center. The most problematic and controversial ones is what happens in the forehead. I often get asked, please put a little shot here, so you can raise my forehead, because they obviously were so nervous when they had this done that they didn't realize that the doctor who injected them wasn't injecting here, because that would weaken them and drop them. They were actually injecting inferiorly below the level of the brows, so that we would give the preference to the muscles that elevate, which is the brow elevators over here. One on one side, one on the other side. The central portion doesn't really have a lot, and neither does the tail end. And this is primarily why the tail end of the brow often drops down, and it's one of the reasons for brow lifting, because you really sometimes you can't get it up with just a Botox modulation. These muscles are called the frontalis, and they're very powerful. These muscles are very powerful. These muscles are powerful, and these are powerful. So they're in balance, and we can take sides and we can elevate the brows. Okay, now, if somebody wants me to treat the lines in their forehead but doesn't want me to treat anything down here, I do a simple test. I tell them to close their eyes and tell me, and put themselves in the most wonderful vacation that they ever had. And then about 90% of the time it's one of the islands in Hawaii or somewhere in the Caribbean. Usually involves a beach, so they're there, they transport, and their forehead totally relaxes and the brow returns to the position that if I weakened it, it would be. And often they're way down here, and if I were to weaken the muscles and get rid of their lines, their brows would be unacceptable. And I show them this, so when I ask them to open their eyes, they almost automatically go like this, and I go, no, we do it again until they see that how their eyes would do if I treated that area. So that's not to say you can't treat the brows, but you can't use full strength here unless you treat this area as full strength, unless your brows are too high already. Now, conversely, if I treat the lower part with what is called a chemical brow lift, I inject here, 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 and here, and here. Often, this sets a motion to where the brows rise too much, and especially laterally here, you get a very concentrated peaked eyebrow, almost like Endora from Bewitched. And therefore, in those cases, we have to go back and treat with a little Botox at 1 week or so afterwards, just in here. Now, if I were going to treat the forehead, I would use smaller doses than I normally would here and put them in a lot of different places. Now, Botox doesn't have a little spread, so you have a little circle of influence whenever you're injecting in here. And there are other products like Xeomin and Dysport that actually have more of a spread than Botox. And it may be a good thing to use it there, but again, if you use it here, we worry about it spreading and affecting the eyelid opening muscles. Anyway, so that's the problem with injecting the forehead. It can drop your brow, and it can take care of this problem. It can take care of the problem of the lines, but then you have a problem with your brows dropping. So generally, when somebody comes in with crow's feet, they get 3 injections on each side, a total of 25 units. If they come in with the 11s and with this little line, they get 25 units. That seems to be the magic number in most individuals to take care of this for 3 months. If you continue taking care of this every 3 months for about 2 years, you can spread it to 4 or 5 or 6 months and get a similar result. In the forehead, I use sometimes 25 units, sometimes a little bit less, but in smaller injections. And that's because I want some motion there. I don't care if I don't get any motion here, here, or there. Notice I didn't go down here and get those lines, because if you use the Botox underneath, you can often get some relaxation and some bulging of the lower lid. However, some brave soul plastic surgeons are putting tiny, tiny droplets or very dilute Botox there, but I just don't see the reason to risk a hound dog effect for a 3-month period over that. Now, I'm going to show you these little lines up here. When individuals have this muscle very, very strong and they have a lot of sun damage, these little lines show up. And you can place a tiny little drop over here and paralyze the tail end of that muscle and get a good result there. If the muscle has worked so strongly for so many years and the skin has lost elasticity, even after Botox paralyzes the muscle, you sometimes don't get total resolution of that line. And you may have to use a little filler here, here, here. And I often combine it. I always use the Botox first, because if you don't, the muscle action will just squeeze off that filler, squeeze it out of that line. So the analogy is you don't walk over a newly waxed floor. So you inject the Botox, get it weakened or paralyzed, and then you can fill, and that will take care of that. Thank you.